Yay!
Hello.
Hi.
Welcome to
Hello.
episode 10 of Vulva Talk. I'm Dr. Margaret Cox, dermatologist in Salt Lake City.
And I am Dr. Kylie Mox here. Oh my God, Kylie Moss here in the lovely DC area where I work at the Centers for Vulvovaginal Disorders as an OBGYN. And we should tell you up top that everything we're about to say is for education purposes only and not medical advice.
Absolutely.
10
Perfect.
episodes in, we are super pro.
We know that we know the drill now.
Yeah, we do. All
Okay, so
right.
today,
Well,
what were we starting with, Kylie? What's
we're
the
going to
plan?
start with a question we got on social media, which is about the Skims underwear. And our last episode, I had said something about pubic hair, I think. And,
Right.
we were talking about whether we should waxing, shaving, laser. And the person said, "Oh my goodness, you should talk about the Skims underwear everyone is talking about." I live under a box, so I had to look up what this was. Kim Kardashian and her infinite wisdom has released a line of. You cannot get these, by the way. They are completely sold out,
Yeah, they're sold
as
out
happens.
100%.
Yes, there's a whole line of pubic hair inspired thongs. And so, I mean, my brain breaks thinking about this for so
Yeah.
many reasons. But did you look at them? Did you see the
So
pictures?
so so this is this is a true story. When this came up in my feed, like as soon as it was launched, and I was like, this has got to be a joke. Like I
Yeah, I
literally
thought it
just
was
ignored
April
it.
Fool's, but it's
Yeah,
not
I
April.
ignored it. I ignored it because I was like, "This is not real. This is the most ridiculous thing I've ever heard of," and they're like $35, which I think is a lot for a pair of underwear.
Hmm.
And then I was kind of like, "Wait a minute, I guess this is not a joke."
No.
So yeah, I've seen
I
it.
mean, I think it's a
Um,
marketing ploy, right?
yeah, it's a marketing ploy.
And it
The
works because
idea
here we
of
are
the
talking about it.
Merkin, huh?
And it works because
I
here we
think
are talking about it.
here we were talking about it. I mean, it's sold out. I don't know if it was like a one-off where they just made like one
Hmm.
batch and then they sold everything out and they weren't planning on making it again. But
Yeah.
I you know what? I'm like, fine. If you I don't know how you could possibly wear this like under your clothes or like as a part of like a functional wardrobe because it
Right.
seems pretty non-functional in terms of everyday clothing, but maybe it's some kind of a
Layering.
fetish thing. I don't know.
Yeah.
I do like that it brings to mind the of the historic idea of the merkin being a toupee for the genital
Yes.
skin. That
Yes. And
that's
I
kind
looked a
of
little bit
interesting.
into that history
Yeah.
for this podcast because the Merkin was basically a pubic hair prosthetic. And in the
Mhm.
history of it is checkered, but often was used by sex workers who by things like syphilis, which caused loss of pubic hair. But
Mhm.
also, I think the Merkin, if they wore it, could be a protective barrier, actually. So it was both to conceal, but also to protect.
Yeah, and I think even with like if you had like pubic lice, you want to shave the hair so that the pubic lice are
Right.
not actually living
No
in there. So
habitat.
that is kind of a form of treatment. So you would have to shave the hair, but then you could still have a hair by wearing a merkin.
Right. Right. I mean,
Yeah.
I think what, you know, whatever, market whatever you want. I think it's just a wild thing where I mean, I have trouble with industry that is profited or profit based on beauty standards is always something that's going to rub me the absolute wrong way. And I think it's like it feels like a twisting the knife when you've marketed this standard of hairlessness. Like
Right.
Skims are designed to make everything smooth and everything's constricted, and then you then sell people back the thing you've marketed to them that they need to remove
Right.
and pay more it's just I'm like, man, that's a lot of layers
This
of exploitation financially. I just have a
I mean,
real hard time with that one.
I have yet to hear from anyone who's actually purchased this
Yeah.
and tried it on. So I don't know how much of this is just some kind of a lie. I don't know anymore.
Yeah. Yeah.
And a lot of people, when I had posted on this on my on social media, were just kind of like guffawing at the ridiculousness of
Right.
this product, this piece of clothing.
Yeah. And by the
So
way, it's a thong, which I don't
it's also
recommend.
a thong.
I
Gosh, and
mean,
it's like, I mean, I feel like I did make a video about this, and I talked about how it was like from a synthetic fabric, which can have
oh,
its
of course,
benefits, but
sure.
also like, can be potentially irritating. And I imagine that the hair is scratchy and irritating as well. So
I mean, it
I'm
looks
not
like
I
a recipe for contact
Yeah,
dermatitis.
exactly. I mean, it's just like all the bad things. So if
Yeah.
you have tried
Yeah.
this underwear, can you please comment and let us know how
Please
it
let us
feels?
know. Let us know. Yes.
Because
And
I
maybe
would
it's the
be,
best underwear you've ever had, in which
yeah,
case I
it
will
just feels
retract.
great.
Yeah. I'll retract my statements. Anyway, okay. So that's our little in the news segment. So then, it's viral season, and so I was sort
Yeah.
of looking at what is in the literature lately, and yeah, I had hopes for this article that didn't exactly bear out, but there was a review called Viral Infections of the Vulva, a narrative review. And so I thought we could talk about that. And that came out recently in Life. That's the journal.
Yeah.
It was published in August, so relatively recently. And
Yeah.
it's about viruses that specifically affect the vulva. I was sort of hoping it would be about viral syndromes that affect the vulva
Mm.
because I'm sure you see like EBV, mononucleosis is the like popular name for Epstein-Barr virus infection. And you can feel really poorly. And we see people get vulvar irritation when they have viral illness. But this is actually about things that are more specific to the vulva. So did you take a look at it in the brief time that we were kind
Yeah,
of going
yeah,
over
and
it?
I mean, I think I do see the things they talk about. So HPV, human papilloma virus,
Mhm.
HSV, herpes simplex virus, a molluscum contagiosum virus. I don't know why the lipschutz thing is in here because it's not really a virus.
It feels
Although I
really
guess it
well. I
could
mean,
be,
it's yeah,
presenting
it's
when you
secondary.
have some kind of
Yeah,
other infection. Yeah.
MV and COVID. Yeah, have all. I mean, I think we've mentioned this before. I've seen a fair bit of. I've seen more aphthous ulcers, also known as Lipschutz ulcers, secondary to both viruses and also vaccination. Sometimes I've seen them post vaccination. Yeah.
Yeah.
And I wouldn't counsel anybody differently. Still get your vaccinations, but I have seen these post vaccine.
Yeah. Yeah,
Yeah.
like COVID vaccine. I've seen that.
Yeah. So maybe we can go down the list. So
Yeah.
for condyloma, and I think it's especially great to have your insight as a dermatopathologist, like what's going on in terms of the skin in a condyloma. Like what does it look like under the
So
microscope?
classically
Or the label.
you're gonna have mostly you're gonna have thickening of the epidermis, so that's the topmost layer of skin.
Hmm.
And there may be some viral cytopathic change that is kind of like a warty viral cytopathic change.
So irregular, right? Like not smooth as much,
Yeah, so
bumpy,
like papillomatus, which is kind of like
warty,
bumpy,
bumpy.
undulating. You can have thickening of the granular layer. It's basically like wart, really, that you would have on other areas of the skin. But in
Yeah.
the genital skin, it's sort of triggered by strains of virus that are more classically associated with genital skin infection.
Hmm.
Sometimes when we get things that look like seborrheic keratoses, so those are the kind of benign growths of the top layer of skin that we can get anywhere in our
Like
body.
skin tags. Yeah.
Well, kind of. Usually they're like
Yeah.
verrucous, stuck on papules that
Yeah.
are brown. They can be skin colored. They can be pink.
Yeah.
If they have it in the genital skin, I kind of always am like, well, given the location, it might be driven by an HPV strain. But yeah, so these clinically, I guess, present kind of similarly where you have like a stuck-on papule, a verrucous type warty growth in the genital skin. And usually I see this more on this keratinized skin,
Yeah. Like the
although I do
outside,
also
not on
see it
the
like,
mucus, not
yeah,
on the shiny wet parts of the
yeah,
vulva, but
less
on
less so on the
yeah.
shiny wet parts, although I mean, it does happen there also, but
Yeah, the worst HP I've seen one patient that I've treated for really frustrated recurring HPV. It's all benign. Like we've biopsied. It's never precancer. It's always warts, but she's on immunosuppressants for an compromising. She's on immunosuppressants for an autoimmune disease. And so it's very hard for her to fight off this virus. So she continues to have these pop up even after she has no evidence of disease. And it's not like she has new sexual partners. It's just that the virus is there on her skin and she can't really fight it off. And then the other person I've seen have really, really like extensive HPV lesions that are benign is I've seen it twice in pregnancy. It was really bad,
yeah,
covering and then it was affecting the vaginal canal as well as the external
yeah,
vulva. And in pregnancy, it's always like, ooh, how do we deal with this? Because if there are a lot in the vagina, there is a phenomenon called, respiratory papillomatosis, which
right,
is where babies, as they're being born, can be exposed respiratorily to the
right.
virus and they can get lesions on their vocal cords, which can be hard to treat and
Yeah.
serious. But there's not a whole lot of data that treatment decreases that. So, we just kind of treat what's symptomatic for the patient. Yeah, it's not to the degree that, like, if you have an HPV related lesion in the vagina, that we would recommend a C-section to avoid any
Right.
kind of exposure. But that's not the case with HPV. So that's kind of a good
In the
segue into
HSV.
talking about, or sorry, HSV. So
Yeah.
talking about HSV, so herpes simplex virus, that's very different, right?
Yeah.
In terms of risk in pregnancy.
Absolutely. Absolutely.
Uh,
Yeah, very, very risky to have a neonate with disseminated HSV infection. So if pregnant patients have active genital lesions, then they have a cesarean, right?
yeah, yeah. And it depends on the timing, if it's a primary outbreak or a secondary outbreak, meaning, because HSV lives in your nerves once you've been infected with it. It's usually around and it usually pops up in times of stress or immunocompromise. So if you have an active outbreak in near term, then we would recommend a C-section. But for most people, we put them on viral suppressive therapy. So they take a medication to prevent an outbreak. And that's very successful for most people and prevents them from having issues.
Yeah.
But
So
yeah,
I think what I mean, I love HSV kind of it's very prevalent.
that's an unusual statement.
I know, right? And let me just be it's very prevalent. Every time I see an ulcer in the genital skin, I rule out HSV. And the
With a
way I
swab.
rule it
Yeah.
out is they do a PCR swab. I do not culture. I do not do serology. I will and if there's a blister, I mean, usually they're unroofed. They're very rarely intact in the genital skin. And then I use a swab and I very vigorously scratch,
Yes.
sample the
Yeah.
base of the ulcer
I
and
mean,
send it for
yeah.
PCR. So
Swab. Yeah.
every ulcer that walks into my clinic is HSV unless proven otherwise.
Yeah.
As a dermatologist, that is my standpoint.
Mhm.
And I think I'm very forthcoming about how prevalent this infection is. And I think now there's a lot of, we used to think of HSV1 being in the oral cavity and HSV2 being in the genital skin, but I feel like now there's a lot more overlap with those two. So you can't really tell like how you were exposed to it, but people are exposed to this constantly. Like
Yeah.
babies are exposed
Yeah, I
from
always tell people like 80-90% of people who are sexually active and exposed. So it's not
right.
like if you have an outbreak that you can tell when you acquired it, unless you have a partner who had a known outbreak and there's like a very logical chain. You could have been any partner that you've
Could
ever
be any
had.
partner. And
Yeah.
you're shedding virus without the presence of actual physical lesions as well. So
Hmm.
there probably is virus shed from skin mucosal surfaces
Yeah.
without the presence of a rash, a blister, or anything. And then eventually that might present itself, but you can have it long before the blister shows up.
And we
So
should say that that wide exposure, the fact that so many people are exposed, is the reason that serologies are useless, right? Because most people will have positive serologies for one of the HSV subtypes. And it doesn't mean that you may ever have an outbreak. And so those
exactly.
aren't as useful as the swab of the actual blister that's, burst,
Right.
basically, the
So,
lesion.
some people might be exposed and never have a primary outbreak or a recurrent outbreak
Uh-huh.
because for most people, the
Or,
immune system is very good at suppressing this virus, which is then kind of hanging out in the nerve ganglia and just chilling. And it can just chill
yeah.
there forever. So
And
I
it
have
can
patients who
affect,
come in
yeah,
and they're like in their 60s and 70s, and they're like, well, I've never had this before, and don't have any new sexual partners. And it's like, well, when you get older, your immune system becomes less good at keeping the virus
at
dormant
bay.
or controlled. And then you can have this outbreak, even though you probably were exposed like 50 years ago.
Right, right. Which can be problematic for relationships because people are like, "Well,
Absolutely.
I've never had this before, and is my partner having, a relationship that has
Right.
exposed me?" And I always say, "I can't tell you that. I have no idea.
Yeah.
There's no way to know that without some very,
But the good
you
news
know,
is we have great medications that
testicles."
can
Yep,
help with outbreaks and can prevent outbreaks if you are
that's
someone
right.
who gets repeat outbreaks.
Yep, acyclovir or valacyclovir.
Right.
Yeah, for sure.
And these are very safe and very well tolerated and pretty effective. I mean, I feel like probably more effective at kind of like suppression because if you're having an outbreak and a lot of people get prodromal symptoms where they feel like tingling or itching or pain and the ulcer usually develops in the same exact spot, or the blister or whatever kind of rash you get, and you gotta take the medication as soon as you feel that.
Yep.
And,
It'll
you know,
lessen the time.
I made a video about this recently on TikTok because I swear every time I post a video, I have, like, these HSV bots commenting on my video, pointing to some, like, herbal cure for HSV, and this is a lie and a scam, and there is no cure for HSV. It is incurable. Once you're exposed, you're
No.
infected.
And in fact, there was one effort. I mean, it was decades ago because it was before I went to medical school where there was some new therapy that they thought was actually potentially curative for HSV, and there was a trial, and it was very dangerous. People got very sick, and at least
Oh,
one person in
really?
the trial died because this is it.
Oh,
And I think what happened was that the virus was so disseminated in the and ended up being very toxic. So I think there is. I'm hopeful that with all these advances in like mRNA technology, that we may be able to come up with some sort of
vaccine?
immunotherapy, something that prevents this. Because I get them on my mouth, and it's like so
Yeah,
unpleasant.
it sucks.
You
It's
know?
the worst.
Yeah. But
And yeah, I'd hope so, but as of now, like, that's just not a reality and you're being scammed, so
right.
don't buy into it.
Yeah.
I feel like some of the
Agreed, agreed.
over-the-counter stuff are scams as well, like, a
Yeah.
Breedva. I feel like that stuff doesn't work. It's
Yeah.
really
No
expensive and it's a
evidence for
scam.
it. Yeah.
And the
And then
evidence is,
there's,
like,
like,
awful.
Zysol or some other not Zysol, but
I don't buy
Zysol's
any
fine.
of it.
But,
So, if you're
yeah,
getting HSV outbreaks, go see
Carmex,
your
yeah.
doctor. You can get an oral, antiviral, and, your
Yeah,
life
and
will
it
be
won't
much better.
completely prevent the outbreak, but it will
Right.
be much shorter and much less extensive if you take
Exactly.
meds quickly. Yeah, yeah. And then so that's HSV, and then the next virus that they talked about in this article was molluscum, which is I think about molluscum with relation to kids mostly because kids get a lot in warm environments, moist environments. The virus gets on their skin and they get like a domed lesion with what's called it's an umbilication, just like your belly button is your umbilicus in medicine. These lesions have a little dimple in them that's called an
Yeah.
umbilication. Yeah. So what do they look like on path?
They have a very cool look. They have these inclusions, these cellular inclusions that are called Henderson-Patterson bodies. They have a very specific look under the microscope. Again, have that thickening of the epidermis, but then those Henderson-Patterson bodies that are pathognomonic, diagnostic,
Yeah, yeah,
pathognomonic.
diagnostic. Yeah.
Um, but yeah, I do with kids, definitely molluscum. Um, is transferred via fomites, right, as well. So, like, wet towels or, like, anything that comes into contact with the virus and then comes into contact with someone else's skin can transmit that virus, and my kids, like, I remember my daughter had this huge, massive molluscum, like, on her armpit, and, it was like a giant molluscum, and that's, like, a reported thing in the literature, and then it kind of, like, became really inflamed, really red, and there's a sign usually that means it's about your immune system is
Go away.
finally, like, identified it, and it's about to go away. But in adults, a molluscum is considered a sexually transmitted disease. So I think that's
Right.
important to clarify here.
Right. Because it's
That's
just
it.
contact to contact, skin to
Contact
skin,
to
right?
contact. So I've had patients where I'm like, "Oh, this looks like, molluscum in the vulva," and I usually treat these with, cryotherapy, so I just freeze them at the
Yep.
time, and they actually do quite well, I think, even after one freeze, probably more responsive than if I'm freezing warts.
HPV. Yeah.
Yeah,
HPV is pesky. Yeah.
yeah, yeah,
Yeah.
but,
And the nice thing with molluscum too is like it doesn't scar that much too, usually. Like I
yeah, and
think.
there's no like, the thing we worry about with HPV is that it's carcinogenic. So
Right.
you have HP
Depending
like
on the
certain types of
strain.
HPV, not the condyloma type, but
Yeah.
if you have certain types of HPV infection, so not warts, because you can have HPV warts and then you can have HPV kind of low grade squamous intraepithelial lesions of the
Yeah.
vulva those are kind of benign too. It's kind of the higher risk ones.
Nobody wants a lesion on their vulva, but if you're gonna get a lesion, the molluscum is pretty
Molluscum
easy
is
to
okay.
take care of. Yeah. Yeah, and then there are these lipschutz ulcers, which is the name that we don't use as much anymore. Although this is a recent paper, I think we've tried to go towards away from the like name type terminology and more towards aphthous ulcer, which is what we call lesions of the vulva that can be related to viruses throughout your body. So, people who get like we were talking about briefly, some sort of viral illness throughout their body. Sometimes it's Epstein-Barr, which is the same virus that causes mono. Sometimes it's CMV that can cause these lesions in the vulva, often in younger patients, but can be in patients of other ages. Do you see a lot
Yeah.
of aphthous
Yeah.
ulcers?
I mean, I've seen a few of these. I mean, these are kind of usually present as rather large, incredibly painful ulcerations. Usually they're unilateral. I mean, there can be some
One-sided.
kissing lesions
I
and
feel like I see them bilaterally a lot. Yeah.
bilaterally. Yeah.
Yeah.
I feel like I do see the kissing lesion
Mhm.
quite a
Meaning they
bit.
touch both sides.
Yeah, where they touch on both sides, but, like, they're large. So when I see, like of HSV, these are usually small clustered ulcerations. When I think of these Lipschutz ulcers, they're usually very large, painful, debilitating ulcers in the setting of acute illness. So oftentimes patients will also, have been sick recently. They have a sore
Yeah.
throat. I mean, there's, like, a lot going on. Again, when this comes this is my clinic, I'll always do the full gamut of infectious testing because
I don't know.
genital skin is prone to infection, and a lot of infections can present similarly here. Painful ulcerations, there's a whole differential of what can cause painful ulcerations in the genital skin. And then, if all of that comes back negative, I'm pretty aggressive with treating these because they're so painful. So usually
Yeah.
I'll put patients on oral steroids.
Yeah, they can be really like, they just are really stubborn with topicals. Yeah.
Yeah.
You, like, do half a milligram or a milligram a day of
Yeah,
prednisone, something like that?
I do a prednisone taper, I do topical
Yeah.
lidocaine, I do topical steroids, sometimes I'll give
Mhm.
them, oral pain medication as well.
Yeah. I mean, we sometimes will treat these patients with colchicine, which is like an old school anti-inflammatory, and they're usually quite responsive to it. But it does have some other side effects like hair loss and other things that are like not always so pleasant.
Yeah, if patients are presenting with, I kind of think of Lipschutz ulcers and aphthous ulcers of the vulva as 2 separate entities, primarily with
Yeah,
aphthous being more recurrent. So if patients are presenting with recurrent ulceration of the genital skin,
sure.
is the Lipschutz thing I think of as a one-off, and most of the time it is. I mean, can it recur, but that's a lot less.
Yeah.
Then I'll do colchicine or dapsone as a kind of
Mhm.
oral treatment for that, and that's primarily because these are kind of neutrophil.
And if they are having recurrent aphthous ulcers, then you've also got to like look in their mouth and make sure you're
Right.
not
Yeah.
missing Bichettes or something like
Yeah,
that.
but the patients
Yeah.
that I've had with this, it's been, like, horrifically painful. It's very difficult to do a
Yeah, they're
genital exam.
19 and every time they
Yeah,
get
they're
a little
19
temperature
and,
spike,
they're like, "I've never
then
had sex," and
they're
it's like, "Well, everyone thinks you have syphilis,"
yeah.
or although
But
syphilis is
yeah,
usually
but
not
they
painful.
don't. It's just they have a really robust immune system, and unfortunately, their
Yeah.
vulva is kind of collateral damage when they get sick. That's how I think of it. Anyway.
Yeah, totally, and they
Yeah.
often have stuff in their mouth too because I feel like the mucosal.
All right. Well, I think that's a good little review. This article about these vulvar viral conditions and treatment. So then, what we were going to talk about for your like a social media question, I guess,
Yeah.
would be a little bit more about HSV.
Yeah, I got a
Do you want
bunch
to?
of them. We kind of addressed this, but peripherally,
Yeah,
is HSV serology appropriate for people who report recurrent genital irritation but are asymptomatic at the time of their visit?
I don't think so.
I don't remember the last time I've done an HSV serology test
I hate them.
in my clinic. The only time it happens is because I'm like, let's do this test. And then it was like ordered incorrectly. And I'm like, oh my God, now what do I do with this? How do I interpret this?
Right. And I tell patients, like, as long as you're not having like regular outbreaks, you don't need to be on suppressive therapy. If your serologies are positive, the time that I would worry about it is in pregnancy. I'd put you on suppression in your third trimester, just so that you avoid any kind of calamity with delivery. But otherwise, I don't really worry about it unless you're having recurrent outbreaks, and then you should be on a suppressive regimen. But in medicine, we try not to do tests that don't change our management, and I don't think that that would change my management. So that's why I don't usually get it.
Yeah, I mean, I wonder, but I did think about this question. Like, if someone is coming in and they are kind of having pain, irritation in the genital skin, but not a lot of physical changes.
Could they have like a subclinical
Yeah,
HSV
is this
infection?
helpful? And I actually went to UpToDate to see what UpToDate
Think if there's
what was
any.
the up-to-date shtick on this? And they basically are like, "Okay, we don't really do serologic testing," but in the case of genital ulcer disease, the reasons for serologic testing were: 1, patient with a history of genital lesions who did not have a diagnostic workup or had a negative HSV culture or PCR. I mean, so I don't know. I don't know how much investment I would put in that. Like, so if
Yeah.
someone has genital lesions but doesn't have any right now, then I would test serology. I mean, I don't know if
Yeah.
you can tie the
Again,
2
it's like
together.
it's a test with an uncertain effect on
Right.
management.
And then the second situation was a patient with an atypical presentation. Example, those with atypical vaginal genital burning, pain, dysesthesias. The use of PCR testing in addition to serology may be helpful. I don't know.
I just don't know how.
I disagree.
Yeah, same.
And then the use of serologic testing for screening asymptomatic patients. I mean, I don't know what the role of that is at all.
No, not a big fan.
I mean, and so here it's kind of going again, positive HSV2 indicates anogenital infection, positive
But that's not true
HSV1, right, can
necessarily.
be anogenital or labial. However, since genital ulcers have many possible etiologies, a positive HSV IgG antibody alone cannot be used to confirm a diagnosis of HSV. Exactly. I mean, that's the, so I don't know how,
You
yeah.
can go around and around, but you get to the same, which is like it's not really going to change anything. Yeah.
Yeah, and so I find PCR the most helpful. Sometimes what's is ordered incorrectly as a viral culture, and that I find very challenging as well.
Yeah.
So when I get a viral culture, I'm just like, I can't, and it's negative. I'm
Yeah.
like, well, I don't know if it
I've
was,
never seen a
you know,
positive one.
yeah, I'm
It's
just
usually
like,
got to be PCR because the immune system takes care of the actual active virus so quickly, I feel like.
so anyway,
Unless you're like,
the bottom
yeah,
line, the bottom line is I never use serology. I have found no actual
yeah, like clinical use. Yeah.
clinical use for it.
Yeah.
Okay, and then I had another one here. Okay, so this was another question I got about HSV and GSM.
Okay.
Is
Okay.
there a correlation to frequency or severity of HSV outbreaks in menopause?
I think there's no way to even study that question because as menopause is happening, there are changes in the immune system. So I don't know that you can.
Yeah,
Unless you could look at people who have been put on estrogen and compare to the people who haven't and see if they have less HSV diagnosis. That actually wouldn't be a terribly hard database study to do, but those big database studies are so flawed because they're retrospective nature. So I think it'd be really hard. I do think there are people, I've definitely had at least one patient who never had an outbreak and came in, in her 60s, but that doesn't feel like menopause. That feels like age to me because she's been in menopause a while. Now,
right,
maybe she just got to the point where, it's not like your ovaries stop working overnight. Estrogen slowly declines. So maybe
right.
she just got to a threshold where she really didn't have any. And that potentiated an outbreak. There's, some evidence for estrogen being anti inflammatory, but I just don't think there's great data.
Yeah, I mean, I was kind of trying to think back because I don't think there is like a body of literature out there investigating this potential correlation.
Yeah.
But thinking back to my own patients, and I think it is difficult to tease apart the change in the immune system versus the change in the hormonal kind of milieu of everything going on. But I kind of was thinking like if you're having increased vulvovaginal dryness, micro trauma, but I don't know if that's a thing.
Yeah, there's one looking at hormone replacement therapy and herpes simplex of the mouth. And that maybe there was a little bit of an effect. I think,
Oh,
you
interesting.
know, um that was a 2019 study.
Oh,
It was on gingival health, HSV like
okay, so it's at the mouth,
oral
yeah.
labial. Yeah. Yeah, so this was a cross-sectional study done in India, a very small study, 58 patients, and they just asked them if they were using HRT or if they weren't, and how often they were experiencing HSV, herpes outbreaks in their oral or gingival tissues. And then they asked them how long they've been on HRT and whether their outbreaks were severe. And it turned out that people who were using HRT, that's how they call it, menopausal hormone therapy, had less outbreaks. They only divided it by greater than 8 or less than 8 a year. And the people who had greater than 8 a year was like half of the people in the non-HRT group versus only 18% of the people in the HRT group. Very small study. I don't think it's impossible that there's a connection. I just don't think that it's very well studied. And it certainly doesn't seem like there's a lot of literature in the sort of genital health space. So it was
Okay.
18% versus 50%. I mean,
And
that's pretty.
this is oral HRT, right?
Yeah, this is
Yeah.
like, well, it may not be oral. It might be, I hope it's transdermal. I mean, I think
Oh,
transdermal
okay,
is
but I
much
mean, it's
safer.
not like
Yeah, but
local.
systemic,
Systemic, sorry. Yeah,
yeah,
systemic.
not estrogen replacement. So it seems like, it might be that estrogen status does modulate this a little bit.
Interesting.
Really good question. Okay.
Yeah.
Well, I
Okay.
think that's a wrap
I think that's a wrap.
on
Thanks for
episode
joining us.
10.
Episode
Congrats.
10,
Episode 10.
double digits. Okay, thanks for listening. Follow us on our socials at dr.cocks on Instagram.
Yeah. And Dr. CHAILEEMOSS on Instagram and YouTube and Reddit and all the places.
Cool. Peace out,
All right.
y'all.
10 10. Okay. Bye.